Hi, Mom. Yeah, no, can you pick up Chris after school? Yeah, I'm at the doctor's.
Mrs. Harris?
Describe your symptoms.
Hang on. Stress, headaches, nausea. Yeah, well, I work on Saturdays.
And how long has this been?
Equanimity. Balance your lifestyle.
Hey, Dallas, I'm wrapping up my day. I've had a great day. I've had great guests. I'm going to end with a great guest. Hi, who do I have on the line?
Hi, I'm Dr. Dendy Elgleman.
Hi, Dr. Elgleman. Thank you so much for joining us here in Dallas, Texas.
I'm glad to be with you. Thank you.
Well, I would love to know what you know that you want us to know.
Okay, so today I'm talking about non-invasive procedures that we can do to help rejuvenate our skin for spring. We've come off of a really brutal winter and we're coming into warmer weather, hopefully, and also wedding season. So I have a lot of patients who come to me and they want to know what they can do to make their skin look brighter and to make themselves look younger. So I'm going to walk you through a few things that I talk to my patients daily about. First and foremost, for skincare, obviously it's really important to establish a good skincare regimen with daily SPF in order to protect our skin. But also for sunspots and just overall skin texture improvement, I like a new product called Lytera. It's made by Skin Medica and you apply it twice daily, very easy, and it helps to lighten discoloration and make skin look fresher and brighter. So that's one way that I can help my patients to look better. Also, as the weather warms up, we tend to get more breakouts, and so there's a prescription that's now available that your dermatologist can prescribe if they decide that that's appropriate for you, and it's called Axone, and it's very beautifully tolerated and very effective in clearing blemishes and acne bumps. So that's another option that your viewers can know about. Frequently, as when I have patients come in and they know that they look older, but they're not sure why, and they need my help looking younger, I talk to them about what happens as age-related changes. Our face actually changes, and we go from a very youthful-looking triangle where the base is up here, and we have our cheekbones and apples of the cheeks, to an inverted triangle where we have sagging and hollowness through the mid-face. So I inject Juvederm Voluma here in the cheeks in order to rejuvenate the face, bring the eye up, and make your face look younger and more like that youthful triangle, without anybody knowing that you've done something. And it's very easy to do. It takes minutes to perform in my office, and it lasts up to 2 years. So you have a lot of longevity in a non-invasive procedure. Another thing that you can do is actually to help soften the fine lines of crow's feet and between the brow from frowning. And this is with Botox Cosmetic. So just a few injections will help relax the fine lines and wrinkles in that area. It's one of the only FDA approved options that we have that's indicated for both sites. And it's easy and quick, and within about 2 to 7 days, you'll see relaxation of those muscles and the wrinkles will look less evident. And lastly, there is an agent that you can apply to your lashes, because not only do we get wrinkling around the eyes, but we also have age-related changes to our eyelashes where they get thinner and less thick as we get older. And so you can apply Latisse, which is a prescription medication, just to the lash line at night, and within 3 to 4 months you'll have thicker, fuller lashes. So that's a nice way to look younger without undergoing any procedure. So we've got lots of options for the spring and summer months ahead to look younger and fresher without having to undergo anesthesia or undergo any kind of surgery.
And where can my audience find this on the web?
So if they go to BotoxCosmetic.com or Juvederm.com, there's all kinds of information there. And then obviously they can take any questions they have to their licensed and trained professional for more information.
Now, they should go, just let me ask you a couple more questions.
Sure.
when they're talking about these skin treatments, do they go to a dermatologist, or is there a new category for getting like stuff in your face and all of that?
So usually dermatologists or plastic surgeons are the ones who will do these injectables. And if they go to those websites, then they can put in their zip code and see who is licensed and trained in their region in order to make sure that they've got an appropriate injector.
Okay, and what's the qualifications to be a person to do this? The reason why I'm asking, we just had a big scandal in Dallas, and it's been running for a couple of years, where people were doing like these butt injections out of some little seedy place, and people were paying for them.
Right. Yes. So I think just use common sense. I mean, this is our health, and this is our face, and we want to make sure that we've checked out the people who are going to be doing the procedures. So if it sounds too good to be true, it likely is. So make sure that you look up the person who you're going to be consulting with, and make sure you have a good relationship and a lot of trust in them to make sure that you're in the right hands.
Doctor, I want to thank you so much, and thank you for bringing that information, and I hope my audience is listening about the warning part.
Yes.
Please do that.
Thank you.
Thank you, Doctor. Thank you. Please come back.
I will.